Hello everyone, very happy to be here. I'm PT Chong, the General Manager of Zeiss. I'm a Singaporean, but a Taiwanese son-in-law, my wife's Taiwanese, and I'm very happy to introduce Zeiss to everyone. So the first title, the first slide is Seeing Beyond. This is our goal for Zeiss into our new year 2025. We want to see beyond, we want to shape markets, we want to develop the next future market innovations. So a bit about my company, Zeiss first. So here are our founders, Mr. Carl Zeiss, and also his partner, Ernest Abe, and both of them are really experts in physics, in optics, and they are also the founding members of a lot of mathematical formulas, which is essential for the future developments of a lot of in the arena of optics. So the interesting thing about Zeiss is that we still belong to a foundation. And why is Zeiss not a publicly listed company? It's because when Mr. Zeiss passed on, he decided that the company should continue to do the right things. So right things like corporate social responsibility, continuing doing research, which perhaps, being a listed company, there's a lot of restrictions. So right now Zeiss still runs as a foundation, and our group is split into also two areas. There's the Zeiss company, and there's the other company called Schott, which is expert in glasses. So you may know that currently on the vaccines topic, about 70% of the world's vaccines are using shot glass to hold it. So let's go on. So as I mentioned, innovation is in our DNA, and in Zeiss, annually we have about over 500 patents being approved, and last year we actually have 580 patents being approved, and this is quite an incredible amount, meaning that almost one patent a day. So just imagine by 6 p.m., oh, I got a new patent, and maybe by another 3 p.m., oh, I got another new patent being approved. And we continue to invest in our future, invest in research and development. So we invest about 13% of our revenues into research, and that amounts up to about 800 million euros. And despite the pandemic, we haven't reduced that. A lot of companies may look at ways to manage costs, but for Zeiss, we actually accelerated our investments in research and innovation to try to find the next breakthrough. So that we have about 335,000 employees worldwide, represented in 100 over countries, and with also 50 locations throughout the world. So we are quite a globally well-established country and well-represented throughout. And a bit of our milestones highlight, so 35 Nobel Prize winners use Zeiss research microscopes for their research. So we actually sent 50 cameras to space. So the most iconic moon landing step by Mr. Armstrong is actually captured using Zeiss camera lenses. So that was last year, whereby we celebrated the 50th year of the moon landing, and 80% of the world's microchips is actually produced using Zeiss optics in the ASML devices. And we also have a very famous camera lens division, and we have about 10 Oscar-nominated movies being shot with Zeiss lenses, and we actually won 3 technical Oscar awards before. And we are most famous for actually our surgical microscopes, and annually we estimate about 15 million surgeries on cataracts, neurosurgeries are being operated using our microscopes and our technology. So the theme for today is about eye healthcare. We are an eye healthcare company, a company in eye care, in healthcare, with optics in our DNA, and also focusing on innovation and digital. Maybe a bit different from all the other technology companies around, okay? So here to just ask everyone some questions. First question is, what's your impression on eye examination? What do you feel when you go to have your eye check, okay? So on this part, we are talking about technology in eye care. Would you actually believe that we can bring the highest technology to a refraction process, to an eye care process? So for a lot of people, probably this will be your experience when I ask you, what's your impression? You go to optometry center, you get your eyes checked on a yellow device, you get a piece of paper, and then finally they use a ruler or they use a pen to try to get your pupil data. If I tell you that today, the refraction process, the whole eye examination process has actually evolved into a very high-tech process, would you believe it? So currently what Zeiss we are trying to achieve here is to bring the latest innovation into the eye care process. Our eyes are a very important part of our body. About 80% of our stimulus comes from our eye. So we have to treat it well. So we advocate this process whereby each station of the eye check is using our Zeiss devices, and actually everything is managed using digitalized, using an iPad. So no paper is involved. So using this manner, we can control each step of the way to make sure it follows a standard operating process, and using Zeiss devices to ensure the highest accuracy, to ensure that the consumer gets what his eyes required. So I'm so very happy to report to everyone that we are able successfully to realize such a system, what we call the Zeiss Vision Experts. Currently, there are 45 stores in Taiwan adopting this entire system, and we also provide the very professional training to them, and also including the whole shop design to make sure the consumer and the patient flow fulfills our Zeiss global standards. Next is our latest groundbreaking device. As you all know that if you wear a suit, it has to be tailor-made to fit, to look good. And same thing for spectacle lenses. You need it to fit it well on your face so that your pupil is looking through exactly the optical center of the lens. So therefore, we design, using technology, this special device with 9 Zeiss cameras, and in 1 single second is able to capture all the data to ensure accurate centration. So if you got the best product, the lens product, but if you don't center it well, it doesn't work at all. So therefore, we created this groundbreaking device with 9 cameras, 40,000 measurement points to make sure that it sits perfectly on your face, to make sure your eyes are deserving the best optics ever. The next question, spectacle lenses for pandemic prevention, would you ever think about that? So this is where we have the latest Zeiss antivirus lenses. So in our normal lives, we probably know silver ions for clothing, silver ions for bags, silver ions for masks, silver ions for hand wash. What about silver ions on spectacle lenses? This is technically viable, and it's not just a dream. It's a product that we have already released in the market for probably about 6 months. So when we first encountered the pandemic, the COVID-19 pandemic, our researchers, our production team got into overdrive to think about if we can also contribute to the fight against pandemic, if we can try to vaporize silver ions onto the lens to try to add another layer of protection, another layer of trust onto the lenses. So we got into overdrive. We really worked on this project very hard, 24/7 for 3 months, and we successfully was able to implement this. And what's so good, other so good thing about this is that the add-on on this additional layer of protection, it comes without losing any transmission, it's odorless, and it's toxic-free. So it's really something additional that we can help and contribute to the fight against the pandemic with these Zeiss antivirus lenses with our latest coating. The next part is, do you know that Taiwan will become a super age society in 2025? And that's not far away. That's about 3-4 years from now. It means that 20% or more of Taiwanese population will be 65 and above. This is quite a scary number, and I'm sure the government, public healthcare, is looking at the healthcare infrastructure in all areas. And right now, everybody's using a smartphone. So the eyes of the 65-year-old will definitely be a key consideration for us. And what will Zeiss, do in such a situation? And this is what we call we want to introduce preventive care, and we want to create a eye health care ecosystem. So a bit more about that. For example, do you know your eyes are really the soul to your entire body? And it's also the only organ you can see the blood vessels without any surgery. So it means that through the eyes, it can reveal a lot of information. For example, diabetes, hypertension, etc. Without having to go through any tedious blood tests, they can actually reveal a lot of information about your health. And do you know that nearly half of blindness is preventable? So this is one thing which I don't really understand. We go for our yearly blood check, we go for a yearly cleaning of the teeth, dental care, but for our eyes, often we hear, oh, you should have come earlier. So we just wanted to really solve this problem. How do we introduce preventive care? So currently, the optical store and the eye doctors probably is working quite independently. And what Zeiss wants to achieve is something very simple and something which probably you may have heard of before, to introduce screening solutions at the optical stores. So when the patient, when the consumer goes there to get his glasses, to get his sunglasses, he gets a shot, a check on a picture of his retina. And this picture is remotely sent to an eye doctor in Taiwan using our ecosystem, using our platform. And when the patient returns back to the optical shop, he gets a report. So there's no inconvenience. It's by the way that he would able to get such a professional report. And we are also hoping to introduce an AI system to this retina picture in the future. This is not new. You all probably have seen this before. But the difference is that currently, most of what you see in the market are technology companies looking into areas whereby they can try to do something, make some money maybe. But the difference is that Zeiss, we are eye care company. I have a healthcare company using technology to proliferate this system to improve public health care. And we can create this success because we work closely with the eye doctors, with the retina specialists in our medical department, and we also, in our visual care department, work with the best optometrists. So here, we are able to tie this both up to be able to proliferate the whole concept and to contribute to the public health care of Taiwan. And this is an example of our introduction of this eye healthcare ecosystem in a very, very massive way about 9 months ago. The next question is that do you know that myopia rates in Taiwan may reach 99% in Taiwan by 2050? So on the right, on the graph, is a demographic research, and I just extrapolate upwards. Okay, it's not exaggerating, it's by science. We could hit that number, and what's scary is that the early onset of myopia is increasing. You can see that. And actually, all these technology companies, we are also contributing to this. And all the pandemic, work from home, learn from home, overutilization of our smartphones is also contributing to this. And on this particular area, what Zeiss want to introduce and support is what we call the Zeiss myopia management system in a total solution manner. Total solutions is really overused, the word. And what Zeiss mean by total solutions in myopia management is the following. So today, the modern day kid, he lives in a spectacular life. He has to go to swimming class, he has to learn on his iPad. So I don't think parents should say that, well, in the past, I don't have a smartphone, I live freely. No. It's not about with or without. It's about adapting. This is the modern day kid, and you need to think about what he needs. So we advocate a system whereby the medical works with the optical and the behavioral to provide a total support system for the modern day kid. So the eye doctor working closely with the optometrist and the parents and the teacher. So for the eye doctor, he could introduce atropine drops. He could also introduce XL lens measurement. And for the optical shop, he could introduce lens solutions. And for the parents and the teachers, he could also ensure that the kid is using proper eye care and resting his eyes in different conditions. And on the next level of total solution, here we are talking about precise refraction, accurate centration, and a good lens. So we often overthink about the efficacy of the solution, okay, of the lens. But if you think about it, you have the best lens, but if you measure it wrongly, if this kid needs minus 100 and you give him minus 200, it doesn't matter what lens you give him, it's not going to work. And if you fit the frame poorly on the kid's face, it also doesn't matter what good lens you give him. So here we talk about 2 layers of total solution. First layer, a total system with the medical, the optical, and behavioral. And next is within, let's say, the optical shot to get the most accurate refraction and the centration and also a good lens. And this is what we want to offer to the society in the face of really, really high rates of digitalized product utilization. The next question to ask everyone is that, okay, on the left you see doctors in surgeries. They are using the oculus, a very, very small screen, very painful on the neck, and the surrounding assistants may have a hard time figuring out what's going on. But when we go home, we sit down, relax, we see a 70-inch screen. This doesn't match. So why at home in theaters we are looking at 3D screens, crazy screens, but during professional surgery we are still looking at oculus. So this is where Zeiss comes in to introduce what we call a 3D surgery technology with our Kinevo and our Artivo device. So we are applying this technology into neurosurgery for the brain, for the spine, and also ENT, and also on cataract surgeries for the eye. So we are introducing this 3D technology so that surgeons can operate better, the environment for assistants, for resident doctors to learn can be much better. And we are also we also introduce a lot of robotic functions to support the surgery of the doctor. When the doctor uses the microscope, this is very important for him to see clearer, see better, for him to make decisions. So here we are incorporating a lot of technology and bringing the 3D concept for these important surgeries. So the last question, how do we facilitate digitalization in our healthcare ecosystem? This is where we bring in the forum. So for a long while, a lot of people is focusing on the best products. But as we move on to an aging population, what we discover is that doctors have increasingly less time, increasingly less patient time. So what we want is to integrate all these devices that we have together to make the necessary analysis so that the doctors will not have to waste time in integrating data, does not have to waste time to look at, to make analysis. All this can be pre-run by our system. So here we look at this in a digitalized healthcare system as the future, and we want to introduce this type of work process and workflow to the eye doctors in the near future. Last but not least, Zeiss, we are celebrating our 175th year this coming November, and one of the key reasons we are able to sustain and to grow for this long is because innovation is in our DNA. So thank you for your time, and we look forward to introducing even more new innovations in the future. Thank you.